There's a flu storm intensified by vaccine lethargy. There has been a decline of 33% in flu vaccination this year, and the outcome is, well felt. Abundant cases of flu are happening just when Israelis are wearing face masks and should be more protected than usual. We're now joined by Professor Jaron Rabinovici. He's the Vice Chairman of the Division of Obstetrics and Gynecology at Sheba Medical Center. Thank you very much for being with us.
Thank you for having me.
How many cases are you seeing of patients who have contracted both COVID and the flu, and how severe is the combination?
Actually, and fortunately, we at the Sheba Medical Center have not yet encountered such cases, and the cases are quite rare, but they are upcoming for a very simple reason, because influenza is rising, and as you just reported, the COVID numbers are also rising. So there is a good chance that patients, and especially women and pregnant women, will contract both diseases. There are few cases reported already in Israel, and fortunately, these cases have been dealt with quite well. But it just raises the need for additional vaccines, both for influenza and COVID, because both diseases are much worse during pregnancy, and we have to avoid the occurrence of both diseases, which can affect and be quite bad for the pregnant women.
I know that first case of a woman who was diagnosed with both the flu and COVID was not vaccinated. I'm guessing that if one is vaccinated, then the disease shouldn't be as bad or as difficult for a pregnant woman?
No doubt about that. The vaccination of both diseases helps women to be protected. And as we can see, vaccination against COVID protects those that are still either vaccinated or have the virus and are carrying the virus, helps them to overcome the disease quite easily in most cases. And we can see that most difficult cases are those that have not been vaccinated with COVID. And the same thing is also true for influenza.
Now, I want to take a step back, because all this is so new that it's very hard to really deduce a lot of information from it. But what have you found so far in your research into the long-term effects of COVID on pregnant women and on women's health in general?
We all know that many opinions have been voiced since the beginning of COVID, and especially since the beginning of the vaccinations. And one of them was that COVID vaccinations, the mRNA vaccines, are going to hurt and harm female fertility. And we have recruited 200 women and have examined a protein that is very significant for the ovarian function. It's called AMH. And we have examined this protein before vaccinations and 3 months later, after women received the 2 first vaccines. And what we saw was that their ovarian fertility has not changed, so that we can say right now quite definitely that the mRNA vaccine does not affect ovarian function in women. In addition to that, we know that couples who have undergone infertility treatment before and after vaccination have not seen, and we have not seen, any changes. And at the Sheba Medical Center, we have conducted studies upon the conduct of the pregnancy after COVID and after vaccinations, and we are quite certain that the vaccines themselves do not harm the conduct of the pregnancy, and that the pregnancies are going well after vaccinations, in difference to what I said before, that COVID infection can be quite heavy and can be quite problematic in affected pregnant
Before
women.
we part, Professor, I can't let you go without asking for a word about your occupation that is quite under fire these days from a lot of women. How are you feeling these days, and what do you have to say to your colleagues?
First of all, I was surprised by the news about the cases that have been put forward. There is no doubt that our profession is putting a delicate situation, both us and the patients, and you have to give the patient all the benefits that she needs in order to feel protected and to feel well during this exam. And actually, it's quite clear. It was clear before these cases were put forward in the media, and definitely right now too. And I mean, there is no doubt that if these cases prove to be right, then we have again to put forward to the patients and to the treating physicians all the guidelines that are already in place, by the way, in order to avoid similar cases in the future.
Professor Jaron Rabinovici from Sheba Medical Center, thank you very much for joining us today.
Thank you very much. All the best.